Senator Mike Crapo is a member of the Finance Committee. He joins me now in an exclusive interview. And Senator, you proposed a timeout to the Senate investigating the premiums and other failures regarding the law. What was her response, and were you satisfied?
Well, as you've indicated, she did take responsibility for the failure of the website. My point to her was that the website needs to be fixed, yes. But we've got to recognize that the rollout of Obamacare is having a lot of the unintended, or frankly, I think intended consequences that we've been talking about. Millions of people are seeing their insurance canceled. They can't keep their own doctor as promised. The promised reduction in health care benefits or health care premiums has not only evaporated, but we're seeing skyrocketing increases in premiums in the individual market. And frankly, now the Obamacare taxes are slamming the middle class, which was also promised would not happen. And so I've suggested that we simply need to take a time out. We need to stop the individual mandate, take the time to fix the website, but also go look at trying to repair some of these incredibly difficult problems we're seeing develop in the healthcare insurance market.
So let's break this down bit by bit. The administration would counter critics who point out what is clear to everybody, that 3.5 to 7 million Americans will have, in the current insurance plan they may like and want to keep, they'll have that canceled. What the administration is saying, yes, that's being canceled, but you're getting a better option. Why is that counter from the administration not valid, or is it valid?
Well, it's valid in some cases, but even in the cases where it's valid, that so-called better option is coming at an explosive price. The administration says that health care premiums are coming down. That's not, I think, comparing apples to apples. What we are seeing in the individual market is that for those who can get a health care policy, even after their policy is getting canceled, that policy is costing them far more than it was ever projected to cost before the bill was passed.
So let me ask you about the cost portion of all this, because in Massachusetts, which was the model for this, healthcare costs have not come down. They still pay the most per person in the country on healthcare. In the United States, as we go forward with Obamacare, we don't have young people signing up. They're taking the $95 penalty as opposed to paying the higher premiums. That then creates what they call the death spiral. You have the older, less healthy folks signing up for this, but they're not supported by the younger, healthy folk who'd be paying into the system. Potentially it collapses, and then what do you do?
Well, you've described it perfectly, and this is what we talked about when we were debating the bill, and we're seeing it happen now. Those who are younger are not going to just pay all these higher costs for no benefit. Those who are older are moving into a system that is being undercut by the failure of the economics of the plan. And the death spiral is exactly what we are seeing start right now. And although the administration points to a lot of individual stories about people who are able to get health care, and there are people who are able to get health care with the exchange subsidies, the fact is that the impact as that rolls through the individual market, from young people through middle-aged people to the elderly, is going to have devastating economic impacts.
Senator, do we get the administration saying in perhaps a year, this isn't working, we're just going to have Medicare for all, one single-payer system, and if you want something better than that, you'll pay out of your own pocket?
Well, some have speculated that that was the intent all along. I can't tell you for sure if that was the intent, but I can tell you that that's where the pressure of all of this is driving, to a point where the proposal will be made. Look, this isn't working. It's starting this death spiral that you've described, and we've got to get out of it. The way to get out of it is obviously to have the government take over the control of health care, or to have people who can still afford it just pay for it out of their own pockets. That's not where America should go with its health care system. That's why I suggested today we need a timeout. We've got to get in and start fixing more than just the website.
Senator Mike Crapo, we appreciate your being here. It is a difficult time on Capitol Hill, but thank you for taking time to talk with us.
Thank you.